So we have started a discussion of our unit number 2, that is drug acting on autonomic nervous system. So in that till date we have covered what is autonomic nervous system, what type of neurotransmitter or which are the main neurotransmitters involved in this system. Then their synthesis, yesterday only we have discussed what is the synthetic pathway for the synthesis of neurotransmitters. So we have seen the synthetic pathway of synthesis of neurotransmitters, that are dopamine, norepinephrine and epinephrine. Then we have discussed that what is the triggering mechanism which is going to start actually the synthesis of neurotransmitters. So whenever there is influx of these calcium ions inside the nerve cell, then and then only the whole process will be start, and there is release of those catecholamines. Those catecholamines are nothing but dopamine, norepinephrine and epinephrine. So this is the release mechanism of neurotransmitters in the nerve ending. Now we all know these neurotransmitters are synthesized in our body and they are released towards those nerve endings to show their actions. But release झालेले neurotransmitters, to whom they are going to bind, to whom or to which type of receptors they are going to bind, and they are going to show their activities. So those receptors are adrenergic receptors. Now we all know we are discussing about the adrenergic nervous system, or adrenaline is the neurotransmitter involved in this system. So they are going to act, or they are going to bind to the adrenergic receptors. They are located at the site where adrenergic drugs are bound to produce their effect. Now, these adrenergic receptors are divided into alpha adrenergic receptor and beta adrenergic receptors, and they are divided or they are classified depending upon whether they are going to respond to the norepinephrine or epinephrine. हे जे काही क्लासिफिकेशन केलेलं आहे, that is अल्फा एड्रेनर्जिक रिसेप्टर किंवा बीटा एड्रेनर्जिक रिसेप्टर, हे कोणत्या बेसिस वरती केलेलं आहे? डिपेंडिंग अपॉन whether they are going to respond to the norepinephrine or epinephrine. आता adrenergic receptor आणि alpha adrenergic receptor and beta adrenergic receptor, they are going to have their subtypes, that is 1 and 2. So adreno receptors. Adreno receptors are classified. Already we have discussed they are classified into alpha adrenergic receptors and beta adrenergic receptor. पण त्या अल्फा आणि बीटाचं फर्दर क्लासिफिकेशन आहे अल्फा 1 adrenergic receptor आणि अल्फा 2 adrenergic receptor. Beta adrenergic receptor चं further classification beta 1 adrenergic receptor and beta 2 adrenergic receptor. Now, what are the effects are shown by this alpha and alpha 1 and alpha 2? Now, alpha 1 is going to act on the blood vessels, that is vasoconstriction. He is going to increase a peripheral resistance, increased blood pressure. Vasoconstriction म्हणजे blood capillaries किंवा blood vessels constrict होणार आहेत. So immediately or ultimately there will be an increased blood pressure. So they are going to show the mydriasis type of effect and increased closure of internal sphincter of the bladder. So these many are the effects shown by the alpha 1 receptor. Alpha 2, inhibition of norepinephrine release, inhibition of acetylcholine, inhibition of insulin. See, alpha 1 is going to increase the activity, alpha 2 is going to inhibit the activity. Beta 1, tachycardia, increased lipolysis, increased myocardial contractility, increased release of renin. So increased activities are shown by the beta 1, whereas decreased activities are shown by the beta 2, that is vasodilation, relaxation, slightly decreased peripheral resistance, bronchodilation, increased muscle and liver ग्लायकोजेनेसिस म्हणजे ग्लुकोजचं कन्व्हर्जन ग्लायकोजेनेसिस मध्ये म्हणजे एनर्जी स्टोरेज केली जाते. इन्क्रीज रिलीज ऑफ ग्लुकॅगॉन अँड रिलॅक्स्ड युटेराइन स्मूथ मसल. सो व्हेन वी आर गोइंग टू कंपेअर 1 and 2, one is generally excitatory type of responses किंवा increased responses shown by both alpha 1 and beta 1, whereas inhibition and relaxed mechanisms or relaxed type of activities are shown by the alpha 2 and beta 2 receptors. Now we are talking about the drugs which are acting on this system, that is adrenergic system. Now those are classified into the class that is adrenergic agonist. Now आता आपण बघितलं की adrenergic receptorचं क्लासिफिकेशन अल्फा आणि बीटा मध्ये केलंय आणि तेच अल्फा आणि बीटा फर्दर क्लासिफाय केलेले आहेत अल्फा 1 आणि बीटा 1, अल्फा 2 and beta 2. Now depending upon these receptors there are classes of drug or alphanergic agonist. Agonist म्हणजे असा ड्रग मॉलिक्यूल की जो रिसेप्टरला बाइंड झाल्यानंतर त्याची फार्माकोलॉजिकल ऍक्शन वाढवतो. सो दे आर क्लासिफाइड इनटू डायरेक्ट ऍक्टिंग, मिक्स ऍक्टिंग आणि इनडायरेक्ट ऍक्टिंग. म्हणजे रिसेप्टरच्या क्लासिफिकेशनच्या बेसिस वरती adrenergic ड्रगचं क्लासिफिकेशन प्रोसीड फर्दर आहे, दॅट इज डायरेक्ट ऍक्टिंग, मिक्स्ड ऍक्टिंग आणि indirect acting. So the direct acting drug molecules are classified into selective and non-selective. Selective मध्ये phenylephrine, clonidine, dobutalin and terbutaline. Non-selective, that is epinephrine, norepinephrine, oxymetazoline and isoprenylene. So we are going to discuss these drugs later on with their structures. Before that, we will discuss what is the mechanism किंवा what is the flow of working of alpha adrenergic receptor and flow of working of beta adrenergic receptors. So before we move further, we will discuss first about alpha adrenergic receptors. आता हे सुद्धा adrenergic receptors आहेत. They are selective for noradrenaline आणि adrenaline. अल्फा रिसेप्टर्स ॲड्रेनर्जिक रिसेप्टर्स आहेत ते स्पेसिफिकली सिलेक्टिव्ह आहेत नॉर ॲड्रेनलिन आणि ॲड्रेनलिनला आणि त्यांचं क्लासिफिकेशन आपण बघितलं अल्फा ॲड्रेनर्जिक रिसेप्टर की जे फर्दर क्लासिफाय केलेत अल्फा 1 आणि अल्फा 2 मध्ये. आता यांचं मेकॅनिझम ऑफ वर्किंग कसं आहे. अल्फा ॲड्रेनर्जिक रिसेप्टर्स इज अ जी प्रोटीन कपल रिसेप्टर. एखाद्या फ्लावरच्या स्ट्रक्चर सारखं जी प्रोटीन कपल रिसेप्टरचं स्ट्रक्चर असतं, मध्ये स्टेम असतो आणि त्याच्या बाजूला जसे काही पेटल्स असतात फ्लॉवर मध्ये. सो द सेम स्ट्रक्चर इज देअर विथ दी जी प्रोटीन कपल रिसेप्टर. आणि सो व्हॉट हॅपन व्हेन ॲड्रेनलिन, आता नर्व एंडिंग मध्ये न्यूरोट्रान्समीटर रिलीज होतात ते आपण पाहिलं. How they are going to release due to the influx of calcium ion. आणि हा रिलीज झालेला ॲड्रेनलिन हा बाइंड होतो कुठल्या रिसेप्टरला, जी प्रोटीन कपल रिसेप्टरला. आता जी प्रोटीन कपल रिसेप्टरचं स्ट्रक्चर वी हॅव ऑलरेडी सीन, इट इज फ्लॉवर लाइक स्ट्रक्चर. नाउ व्हेन दिस ॲड्रेनल इज गोइंग टू बाइंड टू दिस जी प्रोटीन कपल रिसेप्टर, they are going to convert, the moment they are going to bind, they will convert the GDP into GTP, that is glucuronide diphosphate is converted into glycine triphosphate molecule. Now this glycine triphosphate complex binds to the glutamine triphosphate complex is bind to the membrane bound phospholipase C. So this glycine triphosphate complex की जो already form झालाय conversion होऊन GDP to GTP मध्ये, it will bind to the membrane bound phospholipase. Now this membrane bound phospholipase will convert a phospholipid, that is phosphatidyl inositol biphosphate, into phosphatidyl inositol triphosphate. See, we will discuss in the form of diagrammatic representation. See, already we have seen that This is the structure of G protein coupled receptor ki J flower like structure ahe. Now when adrenaline is released at the nerve ending, suppose this is our adrenaline. So when this adrenaline will bind to this G protein coupled receptor, the signal is released. Kiva signal pass zala. So this is a signal that adrenaline has bind to the G protein coupled receptor. Now when this signal will transfer, so what happened? This binding will activate phospholipase C is the enzyme which is there on the cell cytoplasm kiva cell membrane varti. Now when this enzyme will be activated, it will bind or it will convert the GDP molecule into GTP, that is activated G protein alpha subunit. Now when this binding will be done, that is conversion of GDP into GTP, after that there is activation of inositol phospholipid molecule will be there. Now this inositol phospholipid molecule, it is biphosphate molecule. Later on it is converted into an triphosphate, that is inositol triphosphate IP3. Now when this diacylglycerol molecule will bind to the inositol triphosphate, there is activation of, if these two mechanisms are done, then there will be an activation of activated protein kinase will be done, which is there also on the cell membrane. Now inositol biphosphate चं conversion inositol triphosphate मध्ये झाल्यानंतर this diacylglycerol molecule will be proceed further and binds to the protein kinase. Now when it is going to bind with this protein kinase molecule, it is activated and it will release the bind calcium molecule is released in the form of free calcium ions. So what happened first? So this diacylglycerol molecule remains in the membrane and activates protein kinase. Now this protein kinase is a protein which will release the calcium in the cell membrane. So when this diacylglycerol molecule binds to this protein kinase, it will release the calcium ion in the cell membrane. And this released calcium ion are responsible to show the activity. This calcium ion is responsible to show the activity. Now, what type of activity will be shown by these receptors? So there is an when these calcium ions are bind to the protein, that is calmodine protein. So this is the structure of calmodine protein where these calcium ions are binding and activates the myosin light chain kinase enzyme. And this activated myosin light chain kinase cause the phosphorylation of myosin light chain kinase. And this will cause the smooth muscle contraction. See how आपण म्हणतोय की अल्फा रिसेप्टर बीटा रिसेप्टर्स त्यांचे मेकॅनिझम्स वॅसोकॉन्स्ट्रिक्शन ने दाखवतात. आत्ताच आपण पाहिलं की अल्फा 1 रिसेप्टर वॅसोकॉन्स्ट्रिक्ट करतोय. हाउ दे आर गोइंग टू कॉन्स्ट्रिक्ट द स्मूथ मसल किंवा हे कॉन्ट्रॅक्शन मेकॅनिझम कशा पद्धतीने केलं जातंय. सो दिस इज अ मेकॅनिझम बिहाइंड दॅट. When adrenaline is released, it will bind to the G protein coupled receptor. Now this G protein coupled receptor, when it is bound, it will convert GDP into GTP. Now this GTP conversion will activate the phospholipase C. This activated phospholipase C will convert phosphatidyl biphosphate into phosphatidyl triphosphate. At the same time, it is going to form the diacylglycerol, which is there in the cell membrane. Now this diacylglycerol will bind to the phospholipase C and will release or will activate the protein kinase. And this protein kinase will release the calcium ions. These calcium ions along with this energy, see this requires energy to bind these calcium ions to this receptor, calmodine receptor. And when these calcium ions are bind to the calmodine receptors, they are going to show the contraction type of action, that is vasoconstriction. So this is the action of alpha 1 receptor किंवा adrenergic receptors, how they are going to constrict the smooth muscle. आणि या स्मूथ मसल कॉन्ट्रॅक्ट झाल्यामुळे दे आर गोइंग टू शो देअर ऍक्शन्स. आता these actions, where they are going to show their actions, they are going to show their actions on vascular smooth muscle, that is vasoconstriction. Genitourinary smooth muscles, that is genital organs contraction. Then radial muscles means eye related muscles, mydriasis. Then heart related muscles, vasoconstriction मुळे increase the rate and force, that is heart contraction. लिव्हर मध्ये पण कॉन्ट्रॅक्शन दाखवलं किंवा लिव्हर मसल वरती increases glycogenolysis. So this is the mechanism how they are going to show their contraction action किंवा constriction action on varieties of muscles. Okay, now हे झालं अल्फा 1 रिसेप्टर वरती. अल्फा 2 रिसेप्टर हा पण जी प्रोटीन कपल्ड रिसेप्टरच आहे. या ठिकाणी सुद्धा अड्रेनलिन बाइंड होतो. GDP चं कन्वर्जन, it is converted into GTP, and the subunits, that is alpha, beta, gamma subunits of G protein coupled receptors are detached. So they are going to activate adenyl cyclase, which will convert the or which will activate the protein kinase. Protein kinase will release the calcium ions, and these released calcium ions will show the vasoconstriction type of activity. So what happens? See, increased potassium. So this GTP complex bind to the membrane, that is adenyl cyclase. या ठिकाणी कुठला बाइंड होतो? डायएसिल ग्लिसरॉल, कारण vasoconstriction ऍक्टिव्हिटी दाखवायची. पण अल्फा 2 रिसेप्टर्स कसली ऍक्शन दाखवतात? रिलॅक्सेशन किंवा इनहिबिशन ऍक्टिव्हिटी दाखवतात. आता when this GTP complex will bind to the adenyl cyclase, त्या ठिकाणी डायएसिल ग्लिसरॉल होता. या ठिकाणी adenyl cyclase आहे. See, where we are, adenyl cyclase molecule, conversion of GDP to GTP. So this adenyl cyclase molecule will convert GDP to GTP. Now this adenyl cyclase decreases the formation of cyclic AMP and this alpha GTP complex to activate the potassium channels. See, या ठिकाणी vasoconstriction करण्यासाठी डायएसिल ग्लिसरॉल मॉलिक्यूल ऍक्टिव्हेटेड प्रोटीन कायनेजला बाइंड होतोय आणि कॅल्शियम आयन रिलीज होतात. बट इन दिस केस adenyl cyclase molecule inhibit झाल्यानंतर there is release or decrease the formation of cyclic AMP, and this decreased formation of cyclic AMP will activate the potassium channel. Calcium ion हा कॉन्ट्रॅक्शन ऍक्टिव्हिटी किंवा कॉन्स्ट्रिक्शन करण्यासाठी रिस्पॉन्सिबल आहे. तसाच पोटॅशियम आयन हा मसल्सना रिलॅक्स करण्यासाठी रिस्पॉन्सिबल असतो. नाउ ड्यू टू द रिलीज ऑफ दिस पोटॅशियम आयन्स from the cell to the outside, this potassium ion will decrease the potential inside that cell, that is hyperpolarization. Now this alpha GTP complex also inactivate the calcium ion. adenyl cyclase active झाल्यामुळे adenyl cyclase decrease करतो formation of cyclic AMP. cyclic AMP formation decrease झाल्यामुळे पोटॅशियमची एंट्री सेल मध्ये वाढते. पोटॅशियमची एंट्री सेल मध्ये वाढल्यामुळे सेल कशी होते? हायपरपोलराइज होते. and due to this hyperpolarization, the first mechanism or earlier mechanism, that is release of calcium ion, will be inactivated, and due to the inactivation of these calcium ion, there will be decreasing in the influx of calcium into the cell, which decrease the potential within the cell and causing hyperpolarization. So they are going to show the inhibition type of activity. See, have you compared both these activities? Earlierly we have seen the contraction activity, that is release of calcium ion by this mechanism. But now when this alpha 2 receptor kiva beta adrenergic receptor, there will be an conversion of GDP to GTP and adenyl cyclase. Now this adenyl cyclase will convert ATP into cyclic AMP, and this cyclic AMP will opens will release this potassium ion into the cell, and this released potassium ion will inactivate the calcium ion. आणि कॅल्शियम आयनचं इनॅक्टिव्हेशन झाल्यामुळे पोटॅशियमचं कॉन्सन्ट्रेशन सेलमध्ये इन्क्रीज होतं आणि सेलमधलं पोटॅशियमचं कॉन्सन्ट्रेशन वाढल्यामुळे सेल काय होते, हायपरपोलराइज होते, कॅल्शियमचा रिलीज कमी होतो आणि they are going to show the inhibition type of activity. So what are the locations where the alpha 2 receptors are located? They are going to locate on the pancreatic beta cell, platelets, nerve endings, vascular smooth muscles. आता हे सगळे all the actions are inhibitory except vascular smooth muscle. Now आत्ताच आपण पाहिलं की how they are going to show the inhibitor action by release or by increased influx of potassium ions. That is, pancreatic beta cell decreases insulin secretion, platelet aggregation, nerves function of autoreceptor, that is neuronal inhibition, vascular smooth muscle, that is vasoconstriction, will be shown by both alpha 1 and alpha 2 will cause the vascular smooth muscle. Now we are discussing about the beta adreno receptors. Now these beta receptors are also classified into beta 1, beta 2, and one more class is there, beta 3. Now they are located, what is the location of beta receptor? They are located on the heart, they are located on the smooth muscle, that is liver, skeletal muscles, they are located on the bronchial, that is bronchial smooth muscles, and they are also located on the adipose tissue. Now just now we have seen the mechanism of working of beta receptors, how they are going to show the activities. Now on beta 2 receptor, जसं की अल्फा रिसेप्टर मध्ये adrenaline release होतो किंवा adrenaline bind होतं, in this case there is binding of epinephrine. Now when this epinephrine will bind to the beta receptors, they will convert the GDP molecule into GTP, and this particular conversion will activate adenyl cyclase. This activated adenyl cyclase molecule will convert energy molecule into the cyclic AMP, that is ATP molecule is converted into adenosine monophosphate, and this adenosine monophosphate will activate the protein kinase into protein kinase A, but there is during this there is release of potassium ions, and this released potassium ions will hyperpolarizes the cell membrane and to show inhibitory type of actions. Now what are the actions of beta receptors? Now they are also balanced. Beta 1 will show increased reactions and beta 2 will show the relaxation type of reactions. So this is a working of alpha receptors and beta receptors. Now we are going to discuss the structures, or what are the drug molecules and their structure activity relationship. आता ही स्ट्रक्चर ऍक्टिव्हिटी रिलेशनशिप म्हणजे काय? जसे की आपण ॲड्रेनलिनचं स्ट्रक्चर बघितलं, इफिनेफ्रिन, नॉरइफिनेफ्रिनचे स्ट्रक्चर बघितले. Yesterday only we have seen the structures of these drug molecules, that is dopamine. कुठले कुठले न्यूरोट्रान्समिटर्स इन्व्हॉल्व आहेत ॲड्रेनर्जिक सिस्टीम मध्ये? डोपामाइन, नॉरइफिनेफ्रिन आणि इफिनेफ्रिन. हे झाले त्यांचे स्ट्रक्चर्स. These are the structures of these neurotransmitters. But see the common ring structure with all those neurotransmitters, they have catecholamine structure, that is beta phenyl ethyl amine structure. Beta phenyl, beta means alpha and beta. Beta carbon atom वरती कुठलं स्ट्रक्चर आहे? फिनाइल रिंग, आणि हे इथाइल स्ट्रक्चर झालं आणि इथाइल अमाइन. See where we are. So we are going to discuss the structure activity relationship. Now सगळ्या neurotransmitters, when we are going to compare the structures of all those neurotransmitters, they have the common structure, that is beta phenylethylamine. See, this is a common structure we are going to find in all the neurotransmitters. So this phenylethylamine, phenyl ring, ethyl means 2 carbon atoms. This is the alpha carbon atom and this one is the beta carbon atom. In the parent compound from which the sympathomimetic drugs are derived. सगळ्या neurotransmitters मध्ये स्ट्रक्चर मध्ये ही रिंग कॉमन आहे. So when we are going to synthesize, आपण लॅब मध्ये ड्रग जर सिंथसाइज करायला गेलो to treat the adrenergic receptors, so which ring we are going to keep in the focus? This ring. Which ring? Phenylethylamine. And this parent ring, by using this parent ring from which we are going to synthesize all the sympathomimetic ducts are derived, which will consist of, this ring is going to contain benzene ring with an ethylamine side chain. And the modification of this phenylethylamine change the affinity of the drugs for the receptors, and they are going to show the pharmacokinetic effects. Because all those receptors, मग तो alpha receptor असू दे किंवा beta receptor असू दे, they are designed in such a way that they will bind to this type of side chain reactions. Which reaction? Beta phenylethylamine side chain. कारण बाकीच्या न्यूरोट्रान्समीटरचं स्ट्रक्चर की ज्यावर की जे जाऊन बाइंड होत आहेत अल्फा रिसेप्टरला आणि बीटा रिसेप्टर, they have this common structure. That's why all the adrenergic drugs which are there, they are derived by using this side chain. Now, substitutions by hydroxyl group at C3 and C4 yield catecholamines. See, आपण डोपामाइनच्या स्ट्रक्चर मध्ये बघितलं की डोपामाइन will have C3 and C4, there is hydroxyl group. So, substitution by hydroxyl group and C3 and C4 in this phenylethylamine ring, they are going to yield the catecholamines. And the chemical structure determine the activity at various receptors and also pharmacokinetic properties. Now, when we are going to substitute this hydroxyl group at this carbon atom and this carbon atom, they are going to give the properties or they are going to synthesize the catecholamines. की जे कसल्या टाइपची ऍक्टिव्हिटी देणार आहेत? हाय पोटेन्सी, रॅपिड इनॅक्टिव्हेशन and poor absorbed orally. These drugs are absorbed orally poorly and poor CNS penetration. Now, these are the structures of these derived compounds. See, we all know catechol, we all know phenylethylamine. आत्ताच आपण बघितलं की this is the main ring which is common in all the neurotransmitters. And when we are going to substitute the hydroxyl group at C3 and C4 position, we will going to generate the catecholamines. And he's catecholamines are nothing but our neurotransmitters. What are those neurotransmitters? Norepinephrine, epinephrine, dopamine, and isoproteinol. Now, in next class, we will discuss detail about all these drug molecules. Now, we are going to compare the relative selectivity of Adreno agonist. आत्ताच आपण बघितलं की बीटा फिनाइल इथाइलामाइन रिंग यूज करून the drug molecules are synthesized by substituting hydroxyl functional group at C3 and C4 position. Now, what is the selectivity of those all neurotransmitter towards the receptor? कुठला ड्रग किंवा कुठली रिंग is more favorable किंवा more selective towards which receptor? See here, phenylephrine, methoxamine, they are selective towards the alpha 1 receptor. Clonidine is the drug molecule which is selective towards the alpha 2 receptor. हे झाले अल्फा अगोनिस्ट. अल्फा अगोनिस्ट म्हणजे अल्फा रिसेप्टर वरती जाऊन अगोनिस्ट किंवा अल्फा रिसेप्टरची ऍक्टिव्हिटी इन्क्रीज करणारे ड्रग मॉलिक्युल्स कुठले कुठले आहेत? फिनाइलेफ्रिन, मिथॉक्सामाइन, they are selective towards alpha 1 आणि clonidine towards the alpha 2. आता beta agonist. Beta agonist means beta receptor ची activity increase करणारे drug molecules. What are those? Dobutamine, which is selective towards beta 1 receptor, and isoprenaline. Just now we have seen the structure. Isoprenaline is the drug molecule which is going to which is selective towards beta 1 and beta 2. हा drug molecule both receptor वरती selective आहे. Then salbutamol, terbutaline, ritodrine, it is specifically selective towards the beta 2 receptor. Now there are drug molecules which are going to show the mixed function activates, that is norepinephrine and epinephrine. They are equally selective towards alpha 1, alpha 2. Put down your attendance in the chat box. Then they are more selective towards the beta 1 as compared to the beta 2, whereas epinephrine is the drug molecule equally selective towards the alpha 1 and alpha 2, as well as equally selective towards the beta 1 and beta 2. And the last one is the dopamine agonist, equally selective towards D1 and D2, whereas more than selective towards the beta as compared to the alpha. So in this way, these drug molecules are going to show their activities. So